Princess of Wales is said to be working from home on her early years project as she continues her recovery from abdominal surgery. This is all as 3 workers from the London clinic where Kate had her treatment in January are currently under investigation for trying to access her private medical records. Today it's emerged that the hospital delayed reporting the breach by a week. Meanwhile, the Queen has been out and about in Northern Ireland today and told crowds there that the King is doing very well amidst his treatment for cancer. Joining us is TalkTV's royal editor, Sarah Hewson. Sarah, good to have you on the programme. A great deal going on. Shall we start with the London clinic, because that's what we were talking about yesterday on the programme. And we hear that they delayed reporting the fact that people tried to access Kate's private medical records by a week.
Yes, the timeline's not exactly clear, Vanessa, but it has been reported that the London clinic, which, if there is any suspicion of a data breach, there is a duty to report it to the data control of the Information Commissioner's Office, the privacy watchdog, effectively, within 72 hours. And it's been claimed today that the London clinic may not have done that for a week. Now, the Information Commissioner's Office, as we know, is now investigating this. They will be looking into whether there were any failings on the part of the London clinic to protect patient data, whether any of their processes were not put in place stringently enough, for example. And I think this could be extremely damaging for the London clinic, because this is a private hospital that prides itself, that's built its entire reputation on its high-profile clients who demand discretion and privacy. And of course, we had that statement from the chief executive yesterday saying that this was taken with the utmost seriousness, but the consequences indeed could be serious depending on what the Information Commissioner finds.
And now we know that it's not 1 member of staff, but 3 who are being investigated. So it sounds a little bit like a sort of collaboration of a kind of internal gang trying to crack the secret code to Kate's private medical information.
Yes, 3 members of staff potentially involved in this attempt to access Kate's medical records, her hospital notes. Now, we understand that that attempt took place after she'd left the hospital. She was admitted on the 16th of January. As you'll remember, she was in hospital for 13 days. It's not clear exactly how long afterwards, but at some point, individuals working within the London clinic, it is alleged, tried to access that medical information. We don't actually know whether they managed to. All of that will be a part of that investigation from the Information Commissioner.
Let's talk a little bit about Kate working from home, because we've only heard really so far that she was convalescing and that she was recuperating and that we wouldn't see her until after Easter. But we didn't know that she was doing what so many others of us are doing, which is working from home.
Yes, I mean, Kensington Palace is a bit reluctant to commit to the fact that she's actually technically working from home. I don't think they want us to sort of see that she's in her sickbed on her laptop, for example. But certainly she's being kept abreast of key work from her early years foundation. And this has been described as her life's work. And there's been a report into its successes today. Now, a particular pilot project, the baby observation tool that was funded by the Princess's Foundation, has been reviewed by Oxford University, and it has been found to be overwhelmingly positive. Now, this is a system used by health visitors. It was first observed by the Princess of Wales when she visited Denmark in 2022. And they've done a pilot scheme in 2 areas where health visitors use this scale to evaluate things like eye contact, engagement from a baby, any kind of distress calls, to try and monitor their emotional and social development, and also those key parent-infant relationships. And the plan now is that this is going to get rolled out further to more health visitors. And ultimately, the long-term aim is that this should be a part of all health visitors' work nationwide.
I mean, this is very important, and I don't always join the dots on this programme, but people who watch or listen regularly will know that only the other day we did an item about how vitally important it is that babies of 22 months actually meet various targets and are, you know, for example, as you say, making eye contact, responding to being spoken to, you know, learning the sorts of things they need to learn. Because if they don't, they will fall dramatically and drastically behind by the age of 16. And that you can see the markers of that as young as 22 months. If they're already not doing what they need to do at that age, you can see the terrible effects of it on their entire lives stretching before them. So what she's doing is incredibly important and also extremely overdue that this should be taken seriously, that early years is as important as Kate thinks and knows that it is.
Yes, and it's very much her focus. And what this particular project is doing is putting the baby right at the centre of any kind of focus by those health visitors. And in those very early years, that is when a baby's brain, a child's brain, is developing at its fastest rate. So the implications for what happens in those early years will be felt in adulthood, in their teenage years and into adulthood as well. So this is absolutely key. The Prince of Wales alluded to it when he was in Sheffield this week, and they started talking about childhood and the early years. And he said, that's very much my wife's territory. She should be here listening to this. And I think she's definitely keeping across all of those developments. And when she does come back to work in April, I think it is certain that that will really be the focus for her, getting back to that core work.
Sarah, thank you very much indeed.